Harvey Rubin. I'm professor of medicine at the University of Pennsylvania, and we founded an organization called Energize the Chain. And Energize the Chain had the insight that there's a lot of power and electricity and connectivity in the most remote parts of the world because the private sector, the cell tower companies and the mobile operators, keep the power on at their cell towers. And they are remotely distributed in the most remote parts of the world. There are more cell phones than there are toilet bowls in the world. There are more cell phones than there are toothbrushes in the world. Basically, the industry has expanded exponentially. Almost everybody has one, some have two cell phones. And we had the simple observation that you can use the power available at these cell towers to run a vaccine refrigerator. So in fact, the cold chain is not a problem in terms of the availability of energy, because what we do is we simply use the energy at the cell tower to power up the vaccine refrigerator. Not only that, we use the connectivity of the cell tower to use and collect data and send messages to the various stakeholders. So what started off as a simple solution in terms of providing power from the cell tower to the vaccine refrigerator has now become a platform, a system solution where we've created our own little ecosystem of vaccine providers. So in our program, we have public, private, and NGO contributors and partners, everything from universities who will do with us our health impact assessment, will help train the healthcare worker. Healthcare workers want to be incentivized. And in fact, being able to give them the ability to expand their careers and give them training in cold chain logistics has become a very valuable commodity for them. Not only that, we have a series of private sector providers, transportation companies, for example. We have alternative energy, sustainable energy companies that help supply energy to the cell tower. We have USAID, for example. We have pharmaceutical companies. All of these groups find it tremendously important to be part of our ecosystem. So what started off as a simple solution to the energy problem has become a general platform where we've been able to build up the ecosystem to solve this problem. And it works in the most remote parts of the world. In Zimbabwe, we've installed 312 sites. We've vaccinated 500,000 kids. In Ghana, we've co-located our cell towers and the clinics with the Ministry of Health and American Tower. We have 30 sites, some in Upper East, Upper West, and Volta, where we're going to roll out in the next month or so, with another 55 that the Ministry of Health have identified as high-need areas that overlap with the availability of the cell tower. So we don't go where we're not needed. We may not be needed in the capital, for example, but there are literally millions of children out in the more remote areas, the fifth child who is completely lost to the system. And so we cover those. And the beauty of our system is that the infrastructure now is strengthened. The health system is strengthened. The individuals' careers are strengthened. We do work with Institute of Higher Education and a number of partners. And what's been really wonderful about this Infuse workshop is that we're meeting new partners, the data handlers. And so we're quite agnostic to which data handlers. They fit right into our ecosystem. Just as we're agnostic to where the electrons come from, whether they come from a cell tower that's powered by diesel or a cell tower that's powered by wind, agnostic to where the electrons come from. They power up the refrigerator, the connectivity is at the cell tower. We can work with a number of partners that we've met this morning and this day at the Infuse workshop. So for us, it's been tremendous. We would love to be able to partner with the people we've met here. They fit right into our ecosystem. And as we expand, we'll expand with them. So we see this as a tremendous opportunity for everybody to gain.